What is the link between chronic pancreatitis and pancreatic cancer? Imagine a long-term fire burning inside the pancreas, causing ongoing inflammation. That's what happens in chronic pancreatitis, a condition where the pancreas remains inflamed over many years. This persistent inflammation can actually increase the risk of developing pancreatic cancer, especially a type called pancreatic ductal adenocarcinoma. Studies show that people with chronic pancreatitis are about 2 to 8 times more likely to develop pancreatic cancer compared to those without the condition. Over a span of 15 to 20 years, the chance of developing cancer can be around 4 to 5%. The risk is even higher in cases of hereditary pancreatitis, which is caused by specific gene mutations like PRSS1 and SPINK1. In these cases, the risk can reach nearly 19% by the age of 60. The reason for this increased risk lies in the ongoing inflammation damaging the cells in the pancreas. This damage can lead to genetic mutations in key genes that control cell growth and division, such as CRAS, TP53, and others. These mutations can cause cells to grow uncontrollably, turning into cancer. The inflamed environment also promotes fibrosis, or scarring, which can further alter how the pancreas functions and encourages malignant transformation. Smoking is another factor that can make this process worse, as tobacco use adds to the inflammatory environment and increases the risk of cancer. Diagnosing pancreatic cancer early in people with chronic pancreatitis can be tricky because both conditions share similar symptoms. Patients often experience abdominal pain, digestive issues, weight loss, and jaundice, which is yellowing of the skin and eyes. Imaging tests like CORT scans, endoscopic ultrasound, and molecular testing of tissue samples are often needed to tell the difference and detect cancer at an early stage. Certain factors can make the risk even higher. Older age, especially over 60, the absence of pancreatic calcifications, duct strictures, and elevated tumor markers like Ca19-9 all suggest a higher chance of cancer developing. Patients with 2 or more of these risk factors should be monitored more closely because their likelihood of developing pancreatic cancer is significantly increased. In summary, chronic pancreatitis is a recognized risk factor for pancreatic cancer because the ongoing inflammation can cause genetic changes that lead to cancer. The risk depends on genetic factors, lifestyle choices like smoking, and how long the disease has been present. Regular medical checkups and advanced diagnostic tests are essential for early detection, which can improve treatment outcomes. If you or someone you know has chronic pancreatitis, talking with a healthcare professional about appropriate monitoring is a vital step in managing this risk. Remember, each person's situation is unique, so personalized medical advice is always the best course of action.